So, Dr. Cummings, thank you so much for joining us. Let's begin right away by you telling everybody in the public when we can expect the HSA to reopen its doors fully.
Thank you. Good morning to everyone. Thank you, Donna, for having me here. So the short answer to that question would be right now. And allow me to sort of clarify what I'm saying. When this crisis, this COVID-19 crisis started, the government, in order to protect the peoples of these islands, they put in place certain measures, suppression measures, that will protect people from getting the virus and therefore limit the spread of the disease.
Right.
Those suppression measures limit to various extent, what activities one can be involved in. And the suppression measures, they were done, in fact, there are actually 5 levels of suppression. There's level 5, which is maximum suppression of your social activity. And that was done because at that time, we knew that there was significant amount of virus in the society. Level 4 is high suppression. It's not as high as maximum suppression, but it's a little less, but still significant amount of viral activity in society. Right. And level 3 is less than level 4, and level 2 even less than level 3. Level 2 is minimal suppression, level 3 being moderate suppression.
Right.
Level 1 is all clear. So we are now at level 2 suppression. And that is based on the science. It's based on the fact that what they've been seeing in terms of the viral activity, how many cases, etc., etc. So those levels of suppression, they're not just something pulled out of the hat. They've been there and they've been put there because of what activities we've been seeing in terms of the virus in the society. So at level 2 suppression, we can open back up to most activities in the society.
Okay.
The only thing I want to say quickly, so now that we're going to open back most of what we've been doing as a hospital, we got to make the point that it got to be done safely.
Right.
That's the key point. And so one of the things, in fact, our operational, if you will, the procedures we're going to be using will be, one, to still maintain physical or social distancing. So when persons come to the hospital, in every department, which I may get into in some details later on, we're still going to adhere to the social or physical distancing. Okay. 2, we want to make sure that persons wear masks. So wearing the mask at any of the hospital, any of the facilities of the HSA, be it in the district clinics, be it in the BRAC, be it wherever. And this is both patients and staff must wear masks. Okay. And then the other important point to make would be that, we're going to be involved in regular cleaning and disinfecting of the frequently held surfaces like the tables, the doorknobs, etc. And so you will see lots of housekeeping staff around the place, oftentimes cleaning. Okay. Those are more or less what we can be doing to keep things safe, to prevent the spread of any more virus.
Okay. So once the HSA has reopened right now, what can patients expect besides some of the protocols that you just mentioned? As far as staff is concerned, will staff be doing anything differently? That sort of stuff.
Right, fine. So there are going to be significant changes in the organization and the functioning of these clinical areas. Persons will be going to ambulatory care, they'll be going to radiology department, they'll be going to other parts. And it would not be the same as before. So first thing, what we will be doing, one, when patients have appointments, we will sort of pre-register them before the time. Okay. So there are no lines now, or minimal amount of lines for registration. So by pre-registering them a night before, hours before, they go there not having to join a line. Not only that, Donna, what we will be doing also, we'll be having patients' appointments spread out, as opposed to every 50 minutes or whatever it is. It's going to be a little longer. And that is done so that when a particular patient is finished with, the housekeeping staff can then go in and do cleaning as is necessary. So that's one of the things you're going to see. The pre-registration, it's changing.
Yes.
And the other things, of course, So persons, for example, once they come into the facility, any patient who comes in there, they got to wear the mask. I said that before, and we're going to sort of screen them for evidence of infection. Ask them simple questions in a polite way.
Sure.
You know, do you have a fever? Whatever it is, you know, any symptoms, take your temperature and so on. So some of those things can be done. So those are some of the different things they will see. And of
Okay.
course, once they, and we should say also that when they come into the facility, except for the emergency type patients who go through the emergency department, most other patients will have to go through the front of the hospital.
Okay.
So we want everybody to come through there, so they can
Okay.
get their screening, they can be seen, they can be asked simple questions, because those questions protect them too.
Yes.
So if we find someone is unwell, we don't expose the other patients to that person. So coming to the front of the hospital, and even when they get to the area of service, let's say it's ambulatory care, let's say it's a specialist clinic, the chairs are seated far apart from each other.
You're right.
So you're pretty safe. And then, Donna, just in case we have, sometimes some patients can take a little longer, and you may have 2 or 3 and you don't want them there, we ask them to kindly remain in the car for a little while, and then as the time is ready for them to be seen, we can call them.
Okay.
So there's some changes going to be made to make them all safer.
So just to enlighten the public, what are some of the services that are going to actually be resumed at this point?
Right. So in terms of the services, we have the pediatric service, the specialist service, internal medicine, surgical, orthopedics, urology. We've got OBGYN, the dental service. We got most of the services, in fact.
Okay.
And in fact, what we say in here goes also for Cayman Brac and for Little
Okay.
Cayman, and also the district clinics, Bordentown, East End, etc., etc.
Okay.
So they'll all be back and running. And I should quickly add, and I want to say this, that we obey the rules of the Health Practice Commission and the government. So while the COVID-19 was at its peak, we were not seeing patients. However, we thought that telemedicine would be good. And so quite a few of my colleagues were seeing patients, the internal medicine. We would call the patients at home, ask them, how are you feeling? Are you out of prescriptions? You know, and if there's anything that needs to be addressed, we would address it at that point in time. And the few persons who were unwell, we would bring them in, very few, because you see, because we would have to determine, is it urgent or almost becoming emergent? So we were doing that
Okay.
during that period of time.
You mentioned medicines. So what about the pharmacy department?
Right.
Any changes there?
Right, yes. So they have already made changes in terms of social distancing. And if you go to the front of the hospital, you'll see we have some steps marked on the ground where people cannot sort of get too close to each other. And they understand that. And the public has been very, very good. They understood everything.
Yes.
Not only that, what the pharmacy has been doing in terms of collecting medications, they've opened a center on Smith Road, in the Smith Road area. So the Smith Road Center is where we have a lot of new HSA facilities. And they have also been supplying patients with medications from there. So collection was being done at Smith Road Center.
Okay.
In addition to all of that, we've had quite a few patients been having the elderly in particular, and the ones who are very unwell, you know, immunocompromised. The pharmacy would take their drugs home, whether it be to North Side, to East End, to West Bay, and so on. So they've made some changes to try and help the patients cope during this difficult time.
Okay. All of these things couldn't have been done without the people of the HSA. Let's talk a little bit about that. As a deputy there, how and a doctor practicing physician for many years, what would you say about the teams of persons that has helped the Cayman Islands people through this crisis?
Right. So I think I almost want to boast, but you shouldn't boast on TV. But I want to boast about, and I've been on the air stating it. You know, the frontline staff, and there are lots of frontline staff, and maybe I'll take an hour to do this, but I'll try and be as quickly as possible. They have, you know, they went into the center of the battle. They were all willing to fight. They were, you know, when the virus came here, people weren't running away from it. They were there to fight, and that pleased me. And so let's start with the EMTs, the emergency medical service folks. They go out there, they pick up patients. We don't even know if they're positive or negative, but they went and they brought them in. So we want to say kudos to them.
Yeah.
We want to say kudos also to the folks, the nurses and physicians in the emergency department, the nurses and physicians in the general practice department, the nurses on the medical ward, surgical ward, the critical care, in the respiratory unit where we house those patients. In fact, they tend to see patients and see them for long periods of time. They're there with the patients for hours. We as doctors go in there and spend 15 minutes, but they spend sometimes 3 hours, 4 hours without coming out.
Yeah.
The radiology staff, the x-ray technicians, you know, patients are taken for x-rays and CT scans and ultrasounds, and they've seen them, and I'm so pleased with the staff. They've done a good job. They've done a good job. But, you know, I can't not say this also. So that's the frontline staff.
Right.
The porters, the housekeeping staff, because they're there too.
Yes.
And they're there and they're helping out. They come and clean the, you know, so they're all part of the team. So we recognize them. And of course, I think the administration at HSA has done an excellent job in that they have supplied all of the personal equipment that we need. The protective personal equipment, we call them PPE, the mask and the gowns and the gloves that are necessary. So I am not dissatisfied. I'm not dissatisfied.
That's awesome. So it's been a trying period for a lot of people who have had loved ones had to go to the HSA over the last few months and not being able to visit them up until very recently, or not be able to, you know, even go there with them once they're checked in. How will that change? Will that go back to normal now that the HSA is reopened?
Right. It will go back to almost normal.
Okay.
Almost normal. And that's a very good point. And, you know, what you're saying is what everybody believes. Look, part of healing is having friends and families and well-wishers around. We wish them well too. The nurses, we pray for patients. So, but nothing like your family around. So I understand. And we understood why that has to happen. So with immediate effect, we're opening back as the suppression measures are relaxed. We are increasing what we can do. And so now, for example, the visiting time will be from 11 a.m. to 8 p.m. back to normal.
Okay.
But there's some changes.
Right.
Like, for example, you know, patients on the medical ward, patients in critical unit, and so on, surgical ward, are allowed now 2 visitors per day.
Okay.
In the past, you may find 5 and 6 persons, but people understand it's not in their best interest to do that. The hospital is safe. It is clean. So I don't want people to think that it's an unclean place. No, it isn't. It's safe, and we do a lot of regular, repeated cleaning and disinfection. But the point is, for the protection, remember that persons can they can be asymptomatic carriers.
Yeah.
And you don't want to have a sick patient and then 10 persons coming to see them. It's not in best interest of the patient.
Right.
So yes, we're opening back up, but we're limiting the visitors. Okay. So for the medical, surgical, critical care, 2 persons per day. Pediatrics, again, they be allowed 2 persons. The NICU, the neonatal intensive care unit, they're allowed persons also. The maternity persons, persons in maternity ward, they're allowed visitors also.
Okay.
So it's all opening back up and will be to the benefit of the patients.
Okay. So now that things have opened back up, and because persons haven't been able to, unless it's an absolute emergency, haven't been able to go and receive services over the last 12 weeks at the HSA, do you think now that people are going to be bombarding and you're going to be inundated, your staff is going to be inundated with numbers of persons coming for services? Right.
So that's a good question. And all the questions are good questions, by the way. So there'll be an increase, but there's not going to be a significant increase. As I sort of hinted earlier, we, the physicians, the orthopedic doctors, the surgical doctors, without calling names, the internal medicine, the pediatrics, they were seeing, they were calling persons home on a regular basis and sort of getting a feel. In fact, patients were so happy when we called them. They were so grateful. They expressed gratitude that we called them to check on them, etc. So that was the ongoing thing. So once a clinic was scheduled. The doctors will go down to the clinic area, get the list, and call the patients and say, how are you? Any complaints, any concerns? And then, my medication's finished, write a prescription and they'll get it. Or, okay, let's do some bloods on you now because we haven't seen you for like 4 months, 5 months. So those were being done. But yes, I think there will be an increase in volumes of patients to be seen. And while we open back up, or as we open back up, I think what is going to happen, the physicians have agreed that should there be a need to see persons, first of all, what we're going to do, let me just back up. We're going to see patients in a sort of phased manner, meaning the more urgent, remember these are not urgent cases,
Sure.
but the ones among those that are more urgent will be seen earlier. So there's going to be a little change to the schedule.
Okay.
But just in case we have quite a few that needs to be seen pretty smartly, then we'd extend the time to see them smartly.
Okay.
That will be done, and we take care of the patients.
Okay. So now that reopening has happened, can persons call and make their appointments as they used to regularly before? Is the process is the same for making their appointments?
It's going to be a little different because we do have a few now, because I have personally seen patients, and I've said to them, my nurse will call you later on. So we got a few that we've seen, but we got to now schedule them into places now.
Okay.
But they can call and they'll be advised. But I think we do have a few that we want to sort of fit in and get seen as soon as possible.
So Dr. Cummings, I imagine that you were probably in the crux of all of the many of the cases, or at least some of the cases that came into the HSA. Tell us a little bit about your experience as a physician when it came to dealing with persons who may have been infected.
Right. Yeah. So yes, we've had to deal with quite a few persons who've had the COVID virus. We've had one patient who was on the ventilator. We've had a few who were sick and in critical care, and a few who were in the respiratory unit, we call it, the unit that is specifically for the COVID patients. And one of the things I would also want to add quickly, while we talk about opening back up and visitors, COVID patients are not allowed visitors. I think I should say that up front now,
Yes.
for obvious reasons.
Sure.
So my experience is that, so the patients I've seen, and my colleagues have seen more than I have done, but I've had a few myself to see. It was rewarding to see them unwell and get better.
Okay.
And we felt so good when we got them better. There was one youngster, I think, who had a stroke, and he seemingly has done well. We know that there's an increased incidence of strokes and so on in this age, in this group of patients. So he's done well. We've had persons who presented primarily with respiratory problems and other problems, and they've done well. So I think it's been rewarding that none of the patients have succumbed thus far, and we're not boasting, but we're just happy.
Yes, yes. Medically speaking, how challenging was it for your teams and for even yourself to deal with something like this, which we don't really hear about on this part of the world, in the Western Hemisphere?
Right. So it's been a challenge for everybody. The last pandemic of 1918, over 100 years ago, so only those who are in that age group could have any, and I guess they can't even remember anything because they were just about 2 years, 3 years. So the truth is we've never seen something like this. And one of the things that happened in the Cayman Islands is that as we were learning of the virus, it started in China, then went to other parts of Asia, then on to Europe. And then we were traumatized, I have to admit, when we began to see the amount of persons dying, especially healthcare workers. In Italy, over 100-something doctors died. So that was the time it was coming down here. So some people were fearful, and I have to say that is true. But we were prepared. The benefit of knowing what happened with others allowed us to prepare better. So we knew then we have to have PPEs. You can't fight this battle without PPEs. If not, it's going to take you out. So the knowledge of what transpired before in those countries allowed us to be better prepared. So there's one. But even as we saw the patients, it's somebody like yourselves. Like, we're all human beings, it's people that we know. And when you see them, you want to work and do the best for them.
Right.
The other thing too, we have what you call a medical task force at the Health Service Authority. And that task force was charged with just devouring the literature on a daily basis. So we will scour all the major journals, Lancet, the New England Journal of Medicine, Annals of Internal Medicine, all of the journals on a daily basis. And we have got people like Dr. McLaughlin, Elizabeth McLaughlin, who's key in that department, Dr. Richards, Dr. Jefferson, Takis Palmer, Dr. Palmer. So every day, and that task force will discuss among each, because it was something that was dramatic and we had to know what was going on. We couldn't rest. And we would go to bed late at night, just reading the journals and talking about it in the mornings. And so it's a matter of being prepared and doing everything that you have to do in order to, if it comes here, be ready. And I think we were ready. We were ready. Okay. The treatment for the COVID virus is not well defined yet.
Right.
It's still not well defined. They talked about something called plaquenil hydroxychloroquine earlier, and azithromycin. Even that is not really on top of the cards right now. Then there's a new drug they're talking about for the last month or so, something called remdesivir. So what we've done too, we've gathered together from time to time, and we've made adjustments to the regimen for treatment. And I should quickly add that medical task force at the Health Service Authority links with the nationwide force that the minister has put in place. There's a group of clinicians involving HSA staff, Health City staff, and also staff from Doctors Hospital, and from the Medical and Dental Council. And we review the treatment and updates and so on. In fact, we are planning to meet sometime in the coming days just to make changes to the treatment for the virus. So it's been rewarding, especially how we've had no deaths per se. The one who died, remember that he had arrested on the boat before he came in here.
Right.
So that was a different thing, but we've been blessed, I think.
Yeah. Let's be honest. There are a few people amongst us who are not comfortable wearing masks, and who, quite frankly, refuse to wear masks or just can't. It's almost, for some people, they hyperventilate and they feel claustrophobic when they wear those masks. How will those people, as few as there may be, if they show up at the HSA and want care, how will those people be handled?
Right. So lots of our staff, in fact, do have problems wearing masks.
Okay.
So a lot of our staff, in fact, have broken out in rash from the mask. The face has gone into thing terribly, terribly. Yes. So it's not unique to the public, even to the healthcare providers. I'm talking about doctors and nurses now. Sure. And they've changed from one mask to the next, and still doesn't help. Yes. So the first thing. The second thing is that, in fact, some persons have respiratory problems from using the mask also. So apart from facial rash, so I'm saying that the mask is a problem for most of us. And we don't like to wear it. No. But the bottom line is that you have to be aware that when you get into an environment, don't forget, at the hospital now we said we do all the decontamination, clean the place regularly. But patients come there because they're sick too. Yeah. So they bring their sickness, they don't leave their sickness at home and then come there and say, okay, I left it at home. So when they come there, they bring sickness with them. And it is in their best interest, in order to prevent themselves from getting infected or contracting anything, they have to wear some sort of covering, be it a cloth mask, something. They have to protect themselves. Okay. The cloth mask is not as efficient, we know, as the mask that we wear, but one has to protect themselves. Okay. And we won't refuse to see them, except that we'll have to have them protect themselves. It is important.
So persons have been following the rules. Government has been, along with public health and health officials, have set the tone, and we look like we're coming out of this in a much better position than many other countries. However, we know that this virus is like most others. You don't know what's going to happen next. How prepared is the Cayman Islands should, let's say, we have a wave of COVID-19 a few months from now or a few weeks from now?
Good question. So it is my view that every part of this area, this region, Jamaica, Cayman, Cuba, they've done relatively well. And again, this is my guess. I personally believe that countries that are near the equator, where the sun is a big issue, where there's lots of exposure to the sun, they've done well. Jamaica, for example, and other countries may not have tested the volume proportionately as we've done here, but yet you don't see people dropping and dying.
Yeah.
So unlike what you saw in Italy or Spain or even the UK, and so you ask the question, why is it so? Not because they sin, it's not because they did anything bad, it's because of the sun. So I just changed the word sin and put a U inside and call it the sun. That's my view.
Right.
I think the sun, the vitamin D, has a lot to do with it. Hold on, let me give you another example. In the Scandinavian countries, Denmark and the places like Iceland, they've done very well too. And the trick here is that they have been fortifying their diets for the young and the elderly with vitamin D. So I submit to you that vitamin D probably has a role to play in why we're not seeing such significant catastrophic illness as we saw in Italy that was so fearful.
Yes.
That's one aspect. I think the other aspect too is the strain. There are two strains, there's the L strain and the S strain. And the L strain seems to be more aggressive.
Okay.
And I don't know what strain we have here. So I think there are some other factors. But the third factor in the Cayman Islands, I think, was the quick restriction. Because you see, the elderly we know tend to do worse and the immunocompromised. And from the time we had the first death here, the place was on lockdown quickly. Because you see, so you couldn't go and see your grandmother, you couldn't go and see your great aunt who are frail. So even if you were an asymptomatic carrier, you couldn't give it to them.
Yeah.
And in Italy and Spain and those places, a lot of persons who died were the elderly, took them out.
Yeah.
It cleaned the place. And so I think, in my view, and it's not written anywhere, it's my view that those are the factors that have influenced why we see what we see. So I think once you open up, it is not unreasonable to find a few more cases. Because
Okay.
you're gonna have persons interacting with each other.
Sure.
You're gonna get a few more cases. But I think should we run into any difficulty, let's say, oh, this is getting too many cases, I think we're gonna have to reverse course again, which is expected because, as I said before also on another program, it's a difficult task for the politicians. You have to balance lives with livelihood.
Yes.
And it's difficult. I don't want to be in that place right now because people get upset when they can't work, they can't make money. So they had to release it sometime, and they've done that in the best way they could at the right time. And hopefully we won't have a backlash. Should we have it, then I have to reverse course to some extent.
Anything else that you want to add at this point? Any final words to the public?
Right. So it is okay that we've said that the government has done a good job. We've said that, and we know that. The government don't need us to tell them that either. They know they've done a good job. The HSA management has done a good job. There's no question about that in terms of acquiring the relevant stuff. You remember what happened in Italy and in Spain? I mean, people died. A lot of them died because of the lack of the proper equipment. You can't send people to battle without ammunition, without guns, without whatever it is. So thank God we did that properly here. The staff, the clinical staff, they've done an excellent job. But I want to talk about the public. I think they did a good job too. I know initially they were a little bit reckless, wayward, and then the premier came out and really said a few things. But after that, they all followed instructions, and I'm so pleased.
Yes.
Because you have to say, well done, Cayman. They've done a good job. And so even as we open back up now, I'll say to people, still be careful. Just be careful. It's going to be a new norm. We're not going to go back to church and hugging each other like we used to do 6-8 months ago. It's not going to happen, not for the near future. And if you remember, there was a virus in 2013, there was one in 2000. It comes in cycles. So we now know what we shouldn't do. And so it's not going to be the same. The airlines, I don't think you can be having seats where when you sit in somebody's elbows in your rib. It's going to be different. All I'm saying that you've done a good job, Cayman. I have to say that. And keep being careful and just keep listening to the instructions.